Hello, everybody. Welcome to another episode of Uncondition Yourself, our talk show on women's health. Today, we'll be talking about hysterectomy and fibroids. Some large numbers around these. 11% of women over the age of 45 have hysterectomy, and 31% of women at some point have fibroids. To discuss this important topic, we have Dr. Prakash Trivedi, and our two ladies, we have Alpa as well as Wrinkle. Thank you for joining us today. We'll hear your stories, but before that, let's understand these terms and what causes these. So let's start with hysterectomy. I know that's the removal of uterus, but what are typically the reasons a woman would have to undergo hysterectomy?
I think so. The commonest surgery, other than cesarean section, is removal of uterus in a woman. And the reasons can be plenty. Commonest reason are excessive bleeding, fibroids, cancer, prolapse, that means the uterus is coming down, painful period, and there are many other things which can lead to removal of uterus.
What causes the prolapse where the uterus comes down?
So couple of deliveries, advancing age, poor collagen, the uterus will come down.
And of all these reasons, what is the most common reason for hysterectomy?
The biggest reason for removal of uterus is either excessive bleeding or painful bleeding or uncontrolled bleeding. And that bleeding can be either fibroid, precancerous or cancerous. Those can be the contributing causes.
And I know you mentioned about, there's an open method of removing the uterus as well as a laparoscopy and the vaginal method. So can you talk about all three options and more specifically, each option, how long hospitalization is required? What is the most preferred and common option these days?
I think so. Being in India, the commonest, the most popular route in India, not in the world, is vaginal removal because we have many great experts to remove the uterus vaginally.
So that's a function of their training as doctors.
Yes, and that there is no hole, everything comes from below. So it's a fantastic technique, and Vienna, few other countries have, but India has best vaginal surgeon. Then abdominal surgery was always there because you have a big tumor, big mass, you open the abdomen, advanced cancer. So open surgery was always there. So currently the duration, if you are talking about a 10 weeks uterus removing vaginally, it may take 25 minutes. If you are talking about a laparoscopic hysterectomy, it may take 1 hour 15 minutes. And we insist to all these patients that after 48 hours you have bath, you can move around, there is no restriction of lifting. 2 months sexual relationship is avoided by any method when you remove the uterus. But otherwise, in fact, we don't change the diet. So they don't put on any weight and they are back to the normal work.
What about workout?
In workout, we always tell that walk or respiratory workout, like yoga is different. So core abdominal, you can start later, but walk and respiratory type
when
of
you
yoga.
Say later, are you talking about 2 months, 3 months?
No.
How many months would you not do your routine if that involved core?
15 to 21 days after.
That's it.
After
so
that surgery.
2 or 3 weeks.
After that, they can jump, dance, swim.
That brings me to our next topic, which is fibroids. I mean, I'm hearing so many cases, we're all in our mid-40s, of my friends complaining of fibroids. So what exactly causes fibroids? Is it always associated with a lot of pain? And is that the symptom where you go get yourself checked?
Fibroid is a monoclonal, simple, non-cancerous tumor. The causes, we have worked for 30 years on what are the predisposing cause. At the end, it boils down to progesterone receptor, which is high. And why it is high, then it comes to luck. But the many things which is decoded with respect to fibroid, we do foresee in 2 years' time, all that can lead to fibroid or increase complaints in fibroid can be controlled by simple medical means.
Got it. And again, you said most cases, they won't even know they have fibroids. But the ones where they can go get themselves checked, would that be mainly because there's a lot of abdominal pain or very heavy periods? I mean, what are the symptoms where a woman would be like, this is not normal, I need to go get myself checked, and then she'd realize that she's got fibroids?
Fibroid always, the major symptom is variation of bleeding, which can be more days of bleeding, which can be clots, which may be painful, may not be painful.
Okay.
And other symptoms of fibroid because of tumor is pressure. The urinary bladder is pressed, so they go again and again to pass urine.
Okay, that's another symptom.
Yeah. Sometimes the urine flow stops because the fibroid is totally pressing.
Oh, okay.
So there can be some sort of those problem.
So is there some statistics to get a sense of if a woman has had fibroids, what are the chances that it will recur and how often would it?
Actually, genetically, small fibroid and a very big fibroid are different. So recurrence of a single fibroid can be 5%.
Okay.
When there are multiple fibroid, it can recur many times. But recurrence doesn't necessarily mean if there is a recurrence, but there is no complaint, then actually we write that there is no need to remove this uterus, no need to remove the fibroid if there is no complaint.
And now again, coming to the correlation between fibroids and hysterectomy, do a lot of women with fibroids end up having a hysterectomy to get rid of the fibroids?
This is a very important question because I always mention that fibroid is a disease of private practitioner.
Correct.
Which means that in government hospital, municipal hospital, not many patients of fibroid go, because if one child is there, they have fibroid, many people say, oh no, it's enough, now you remove the uterus. At our place and many similar places, from all over the world people come, that no matter whatever the number of fibroids are there, uterus will be retained and restructured.
Okay.
So any number of fibroid you can remove, any number of recurrence is not a problem. If it is causing a problem, or say it is coming in the way of fertility or IVF, then we remove that and then take them for treatment.
With that, let's move on to our ladies here. So Rinkel, why don't we start with you? And I'd love to hear about, I believe you had a severe case of fibroids and also a recurrence.
Yeah.
So what exactly happened?
In 2014, I was like, I am a D-thread patient. So
Okay.
like my
As in very
hemoglobin-
low hemoglobin.
Yeah, low hemoglobin.
How much was it?
Maybe 6, around
Ooh,
7,
that's
6.
very low.
So like I was having heavy bleeding, pain, stress, and hemoglobin also low. So I feel like just, I don't want to work. I don't want to get up from the bed. All these things, like it was happening. Then I visited Dr. Trivedi. So sir said like you're having one big fibroids of 9 centimeter, I guess maybe that time. So my age was very small and I
How
was
old were you
newly
at that
married.
time?
I guess 26 something.
Okay, when you had the fibroid, the very
and,
first time.
Yeah, and I was newly married also. So obviously needed surgery. After while operating, he found like I have multiple fibroids behind that 9 centimeter fibroids.
Oh, okay.
Maybe around 5 or 6. Then it was okay. I was fine after surgery. All things were normal. Then he said there will be some kind of complication while during pregnancy or something. But within 3 months, I got pregnant also. After, I guess, 5 years, again same thing happened.
The fibroids came back.
Yeah. Then so again I had surgery. Now I'm fine.
And this surgery was a few months back.
Yeah.
Okay.
I guess
Do you get stressed sometimes that you're going to have a third time that this is going to come up
See,
and then
now
you have
I'm
to go get
prepared
surgery?
because I blindly trust him. I just close my eyes. Whatever he says,
So it
I follow
doesn't
that.
stress you out anymore.
Yeah. Now I have just left everything on him.
Okay. Super, Rinkel. Thank you. Alpa, why don't we move on to you? In your case, I believe you had fibroids followed by hysterectomy.
Yes.
So can you talk to us? Start from the beginning. Like at what point did you realize that this is not normal and I need to go meet a doctor?
Yeah, 10 years back, when I started having too much periods flow and like painful periods, I used to never had. Then I was like a little worried about, but 2-3 cycles I waited because sometimes we feel like is bar hai, next time nahi hoga.
Correct.
Then after 2-3 cycles I visited the doctor and then we diagnosed like, that you have fibroids and good if you remove you should not keep. Then I was like again something comes for first time you get like oh kya hota hai, abhi kya hoga, kitna
Right.
rest karna padega as I'm working, kitna holidays, abhi to mera season ka time hai, I cannot take rest.
You're working, right?
Yeah, I'm working. I run my salon.
So you have to be on your feet
Yes.
and very busy.
Very busy. And then the 10 years back wala fibroid was like too much blood flow was going on. So like I was feeling very weak and very fatigued and like I used to feel very low. So like then I met again to the doctor, and then finally he said like this we should remove the fibroids, and like then strong heartedly I went for the surgery, and it was unbelievable for me that on the third day I was like roaming जैसे कुछ हुआ ही नहीं है, कुछ किया ही नहीं है हम लोगों ने. I was like, can I go for work, can I go? Doctor said you can, if you are comfortable you can go, it's like nothing worried, but do take care of a few things, like don't overwork or like that way. But I was working on the 4th day, I still remember.
Let me just clarify. So this was after a hysterectomy operation, or had you just removed the fibroids?
This was the first time 10 years back when I just removed my fibroids.
Okay, got it.
But then the 8-9 years was like very fine. Like as she said, it was the same again. The 2 years back, the COVID time, again I got started. The pain of the when I used to get my periods, and the new thing I was facing was I used to pass the urine. I was not able to control the urine.
Okay.
It was like some dropping. When I'm talking to the client, मुझे 2 मिनट का भी टाइम नहीं मिलता था वॉशरूम जाने के लिए. If I feel my bladder is full, immediately, while coughing also, it like, and it was very uncomfortable and very shameful. I used to feel like very uncomfortable. I was losing my concentration while talking to my clients, and like, हमेशा ऐसे ही लगता था कि कुछ stink हो रहा है, कुछ dropping हो गया. I was uncomfortable. I used to go to the washroom, and like, then I used to use the panty liners. I was dragging the things badly. Then this time, like we saw, my age is 46 that time. So like doctor said कि अभी multiple fibroids है, इसको निकाल के भी वो recurrency के chances तो है. So now what to do? So he only suggested that removal is like not a bad option.
और अभी निकालने hysterectomy के बाद कैसा महसूस हो रहा है?
In fact, after that मेरा weight भी बिल्कुल put on नहीं हुआ है. In fact, मैं जो रहती थी उससे भी मैं 5-6 kg proper चल रही हूँ.
Were there any other fears you had other than the weight about hysterectomy कि ये होगा वो होगा, based on all the well-meaning advice you got from your women friends at the salon?
Yeah. One very foolish was like, you don't feel like having the relation with the husbands, after you lost that feeling, but no, it's really not like that.
Okay, that's good. So they thought your sexual desires will get affected, but
Yes.
that was not the case.
Total myth. It's a total myth. Even the putting on, it's totally on your food habits.
And you even mentioned when we were speaking that one of these well-meaning friends again told you that it will result in you just looking older and aging, and that was another thing you were worried about.
Yes, I was too much worried about the things. They were like, you lose your all the charm and all, but that's really not.
You look stunning for a 47-year-old. So I think that
Thank you so
she's
much.
a living case study
Thank you so much.
it does not age you by a long shot, because you're glowing, and none of us could have guessed you're 47. And I think that's an important take-home message for our women today. Since a large percentage of us are going to get fibroids or possibly a hysterectomy at some point, let's get rid of the myths. Let's get rid of the paranoia. Like we heard these women speak, a lot of well-meaning people are going to talk to you about issues with, you're removing a body part, you're going to have weight gain, it's going to age you, it's going to impact your sexual desires. But like we understood, all these are myths. We want to be our most positive and productive selves. We want to put our best foot forwards. So let's just go get diagnosed quickly. Let's get this surgery over and done with. And let's aspire for a good quality of life.
तकदीर अपनी उजली, इल्ली ने मन में ठाना है, बन के